Hello, my name is Karyme Lozano and I am doing abdominal aortic aneurysm. For the typical patient presentation, I have a 65-year-old man who complains to his physician of a throbbing abdominal pain that lasts for hours and sometimes days. Besides his abdominal pain, he also feels a sense of palpitations in his abdomen. He notes that he has been smoking for over 25 years now and he is currently being treated for atherosclerosis. For the etiology of the disease, the underlying cause of the abdominal aortic aneurysm still remains unknown, but there are some theories that lead to an abdominal aortic aneurysm, including atherosclerosis. This is when the arteries have a buildup of fats and cholesterol causing the restriction of blood flow. Hypertension, also known as high blood pressure, can weaken the walls of your aorta. Vasculitis, also known as vascular inflammation. The inflammation of the aorta and other arteries can cause abdominal aortic aneurysms. And smoking. Smoking is the most common cause. Smoking can weaken the aortic walls and can increase the chances of the aneurysm to rupture. For the background, it tends to affect 5 times more men than women. It affects the ages that are older than 65-year-olds. The diameter of the aneurysm was found to be the only significant factor on the rate of the rupture, and there are high morbidity and mortality rates that continue to increase throughout the years. For risk factors, there is smoking, which is the greatest risk factor and common cause. Being 65 years or older is another risk factor. Simply being male can lead you at risk for an abdominal aortic aneurysm. The reason for simply being male being a risk factor is still unknown. Your family history, obesity, and the way you eat, your diet, is also a risk factor. Here's an image of how a normal abdominal aorta looks like on the left, and on the right is an image of how an abdominal aorta looks like with an aneurysm. What is an aneurysm? An aneurysm is a localized dilation or outpouching of a vessel, wall, or cardiac chamber. In the case of the abdominal aortic aneurysm, it is a true aneurysm and fusiform circumferential. What I mean by true aneurysm is that it involves all 3 layers of the arterial wall and are best described as a weakening of the vessel wall. And by fusiform circumferential, it is an outpouching or widening of an artery that is shaped like a spindle that goes all around. Here you can see the progress of an abdominal aortic aneurysm from the moment that the abdominal aorta was normal to the aneurysm rupturing. So the first image shows a normal abdominal aorta that is less than 3 centimeters. The second one shows a small aneurysm forming, which is 3 to 5 centimeters. Here we see slow growth, yet the patient is asymptomatic but tend to complain about pain in the abdomen and back. When the aneurysm is this small, it must be monitored at all times just so that it won't grow. The third picture shows the aneurysm being as large or larger than 5 centimeters. When an aneurysm is this large, this shows indications of surgery, an increased diameter, there's a rapid growth, and the patient becomes symptomatic. In the fourth image, you see a ruptured aneurysm, which shows the patient having hypotension, severe pain in abdomen and back, sweating, and an unexplained rapid onset. Here is a diagram of how the aneurysm initiates with risk factors such as genetics, age, and gender. and then it progresses to a larger aneurysm due to risk factors that are being provided by the person, such as smoking, trauma, or hypertension. And some of the elements that are primary structures of an aortic wall play a big role in this because they begin to weaken and degrade, such as collagen and elastin. This is one of the primary structural elements of an aortic wall. As one ages, these elements begin to decay, which weakens the aortic wall. The oxidative stress, linked with many mechanisms of abdominal aortic aneurysms, such as vascular inflammation. So oxidative stresses cause vasculitis, which causes or can lead to an abdominal aortic aneurysm. Cytokines being induced are the main cause of degradation of the extracellular matrix components, which once the aneurysm ruptures, the extracellular matrix degrades and inflammation is increased. Cytokines are being secreted from an inflammatory and mesenchymal cells. Here are the symptoms of an unruptured abdominal aortic aneurysm and the symptoms of a ruptured abdominal aortic aneurysm. The symptoms of an unruptured aneurysm: the patient is asymptomatic, but they usually complain of pain, and this pain is usually in the belly, back, or side. They also feel a pulsating feeling near the belly, but their vital signs are normal. This is where you want your abdominal aortic aneurysm to be completely monitored at all times. That way the aneurysm does not grow, and if it grows, they have time to treat it. The symptoms of a ruptured abdominal aortic aneurysm is when the patient begins to feel severe pain in the abdomen or back. Their blood pressure is decreased and the patient is in shock. For the diagnosis, there are two ways of diagnosing an abdominal aortic aneurysm. One being an ultrasound and another being a computed tomography, also known as a CT scan. For the ultrasound, one can see the dilated aorta. The limitations of the ultrasound is that one cannot see if the aorta has unruptured or not. For the CT scan, one can see if the aneurysm has ruptured or not, and one can see the branches of the aneurysm. The limitations of a CT scan is that the patient must be stable in order to perform a CT scan. Here you can see an ultrasound of your abdominal aorta when it is normal sized at 2 centimeters. And here you can see a CT scan of an abdominal aortic aneurysm that is being pointed by the red arrow. For the treatments of abdominal aortic aneurysms, there are two: endovascular aneurysm repair, also known as EVAR, and an open surgery. For the endovascular aneurysm repair, this is where a stent is added in the aorta to cover up the aneurysm. This forces blood to flow through the stent and not around the aneurysm. For the open surgery, this is where the surgeon uses a graft to replace the weak aortic section of the abdomen. So in the image to your left, you can see an open surgery, and the image to your right, you can see the endovascular aneurysm repair, where the stent is being added in the aorta to cover up the aneurysm. For abdominal aortic aneurysm, there is also screening recommendations, and the main goal for these screening recommendations is to detect and identify the asymptomatic abdominal aortic aneurysms before it even ruptures. Since 2005, one-time screening has been recommended for patients at risk of abdominal aortic aneurysms. One-time screening for abdominal aortic aneurysms with ultrasonography is recommended for men that are aged 65 to 75 years who have ever smoked in their life. Selective screening is also recommended for men aged 65 to 75 years who have never smoked. So regardless if the person has smoked or not, if they are male, they are extremely recommended to get a screening for abdominal aortic aneurysm. That way they can catch it in time and treat it as fast as possible. Here are my references. Thank you so much.